The coronavirus pandemic has brought renewed interest in telehealth, which allows doctors to advise patients virtually. It's a way that people who want to stay out of waiting rooms can get in touch with a health professional in a hurry. Pulmonary specialist Dr. Jonathan Wiesen is here now. He's the founder, CEO, and chief medical officer of MediOrbis. Dr. Wiesen, you've actually had firsthand experience with H1N1, which I know was quite an experience for you because you were a young doctor at the time. Tell us more about that.
Yeah, absolutely. And thank you for having me. Being in the intensive care unit, which is the highest acuity area in the hospital during the pandemic, is frightening. In 2009, when H1N1 emerged and then reemerged in 2012, 2013, we were totally caught off guard by the acuity of patients that we are seeing, extremely sick, very high oxygen requirements, requiring rescue therapies. We were utilizing modes of mechanical ventilation that were not used in years. We had a high frequency oscillator, which is basically a converted jet engine that we were using in order to ventilate patients because we were so desperate. And since then, the critical care world has matured considerably. What's really frightening to providers about the current pandemic is the concern for the sheer numbers that we're looking to see. Even now in areas in New York and New Jersey, we're seeing extremely high numbers of patients who are very severely ill. While we're prepared to take care of very ill patients, one of the concerns is just taking care of such a high number of the most severe. The fact that they're talking about turning the Jacob Javits Center into a mobile critical care unit just tells you how people are petrified about the really high number of acutely ill patients they're expecting to see.
Yeah, I mean, we're much more prepared. We just aren't prepared for the large numbers of people and for the infection to be spreading as quickly as it is. The question, though, is how does telemedicine apply to the coronavirus? Is it practical? Does it really help?
Absolutely. There's no doubt in anyone's mind, I think, at this point, that telemedicine is an extremely useful and important modality in terms of taking care of patients during this pandemic. We all know that the COVID-19 infection is one of the most transmissible viruses that we've encountered, and that puts everyone at risk. It puts healthcare providers at risk. I can tell you that I'm petrified to go into clinic, and my colleagues are petrified to walk into the intensive care unit. And similarly, patients are petrified of contracting anything from those healthcare settings. When I had clinic last week, I think 20 out of 25 patients didn't show. And it's not because they're not sick. I deal with extremely sick patients in a tertiary care center. It's because they're just worried about picking something up.
Sure.
And experiencing, a severe form of the infection.
Sure.
So telemedicine does two things. The first is that it improves access to care. And the second is that it provides care across the spectrum of the geographic locations.
And I can directly relate to what you're saying because my doctor called and canceled my appointment that I had coming up. So yeah, in fact, the appointment's going to be on the phone instead. Real quickly, can telehealth doctors actually refer for the coronavirus tests?
So one of the most important uses of telemedicine is to understand and help triage patients as to who needs to be tested. There are lots of patients who are sick with upper respiratory symptoms and may or may not have exposure. And part of the utility of telemedicine in this time is being able to talk to patients, triage patients, and then direct them to the appropriate locations if testing is indeed indicated. The CDC and the World Health Organization have been great about disseminating information and providing providers with the appropriate information. And now it's our job as professionals, as physicians, to convey that to patients.
Well, Dr. Wiesen, thank you so much. You provided us with a wealth of information. Really appreciate you coming on with us this morning. Thank you so much.
My pleasure. You guys have a great day and stay healthy.
You do the same. Thank you.